But believe it or not, a therapy currently exists and has been approved called Tzield that can delay the onset of type 1. Her name's Sierra, and she got screened, found out she was at risk for type 1 diabetes, ultimately got the Tzield therapy.
Yeah, I have 2 aunts with type 1 diabetes. They got diagnosed, I think, in their 20s. And I have 2 cousins, one that had juvenile diabetes, and then one recently who just got diagnosed at 43 with type 1.
We know that you had gestational diabetes. Tell us how that happened.
So I had my first son. I got pregnant back in 2019. You get screened for gestational diabetes. Mm-hmm. I went in, I did the first phase of that test, and I failed it so badly that my doctor called me and was put on insulin immediately. Oh. And so for the rest of that pregnancy, I was on a relatively high dose of insulin. And that was like my first run-in with diabetes. When Jesse was born and all the blood work was getting done, I got my first appointment with my VA doctor. And since I had a harder time clearing the glucose tolerance test again, she checked my A1C at my first follow-up. She did a whole bunch of blood work. And at that point in time, my A1C got up to a 6.6. And that's the highest it's ever been. And she kind of looked at me and said, all right, you have type 2 diabetes, like without, a second thought. And she said, you'll be on metformin for the rest of your life. And so I mentioned the history of type 1 diabetes, and I kind of advocated for myself a little bit. And she's like, okay, cool, I'll send you out to endocrinology. And so that's how I got the referral to the VA portion of endocrinology with Dr. Edelman there. And that was kind of where I started the screening process for type 1.